So we have Jean here today for people watching, and as you may know, if you follow us on YouTube or Facebook or wherever, we do quite a bit of work on nerves. And one of the things we do with nerves that a lot of people aren't aware of is we use nerves to help people with joint problems, joint pain. And Jean's a perfect example of this because she had surgery. She had a very painful right foot and ankle, arthritis in her right foot and ankle. That many times people are going to think, well, gee, if there's that kind of problem, the end result might be, if you're bad enough, that you might have to have joint replacement, or maybe you have to have a joint fused. Well, no, what we can do here is we actually we do what's called joint denervation surgery, meaning that we can find and select different nerves, usually one nerve, sometimes two, that we remove, and it stops or blocks your ability to feel the pain. And she's an excellent example of this. So I'll let her start talking because it is her video. And so just explain a little bit to the people watching what happened and how you got here, I guess.
Well,
Yeah.
I was in a really bad car accident, and the foot, they told me I'd never walk again, so being able to walk was wonderful.
Mm-hmm.
But the pain got worse and worse until I came to see Dr. Anderson, and he did the
Nerve resection, yep.
and took the nerve out of that side of the foot so that the pain is next to nothing now.
Right. And before you came in, what were you thinking you had to have done? Were you thinking you just live with it?
I had no idea.
I
I had such terrible pain. I couldn't do it anymore.
And so, folks listening, she has had, guys, she's had surgery for her. I mean, sounds like she dislocated part of the foot and or ankle, and she does have some fixation in there. She has some plates and screws and so forth in her foot. But the ultimate thing that can happen, you might need to go back in and do more bone work with like that. And that can work, but boy, it's a big layup and quite a bit riskier, frankly. So let me just show you where her pain was and what we did. So a lot of her pain was more over on this side of her foot. It's up in the ankle and then extending down here. She has had a little bit over here, and we've contemplated, and I kind of warned her at another time we might have to remove a nerve over here. But for now, it seems like she's doing at least 80% better. And so what we did for her, we discovered that it was this nerve branch. It's called the saphenous nerve, and this branch supplies this area. So we simply went up here and removed that nerve. And we do it by doing nerve blocks to figure out what is doing what. And very simple to do. And then she notices she's feeling better right away. And it's probably about a half-hour procedure. We go in, take the nerve, we cut the nerve and bury it in muscle. And she can still function because this nerve does not supply any muscle. So you're walking around fine.
Yep.
No weakness or anything, but just not feeling that arthritic pain. So I guess that's it. I'm sure you're like 3 weeks out and 80%. And is it something you'd recommend
I would.
to other people? Or okay.
Yeah, if anybody with some serious pain, it's a great option.
And like Jean's husband was here and said he can see it on her face. And it's true, because people, it's so rewarding for them and also for us here, just to see how it improves their quality of life. Because hopefully you're going to be getting around more. You're even sleeping better, right?
Yeah.
Was it annoying at night?
Oh yeah, it was waking me up with pain.
Were you taking medication for this? Not really?
Not really.
Okay.
Ibuprofen.
Yeah, okay.
So, no.
Well, we really appreciate it, and we really appreciate you taking the time and allowing us to talk to you and share with other people, because I think it can help other people that are out there. Thanks.